And a new way to study depression may lead to more treatment options for patients. A book just published in the U.S. It's called The Inflamed Mind. A radical new approach to depression examines the link between inflammation in the body and mental health. It recommends that doctors consider patients' physical and mental histories. It's estimated more than 16 million Americans suffer at least one major depressive episode a year. Mood disorders like clinical depression are also the third most common cause of hospitalizations in the U.S. for adults between the ages of 18 and 44. The author is Edward Bullmore. He's a professor at the University of Cambridge in England. He heads the psychiatry department there, and he joins us this morning at the table. Good to see you, Edward.
Good morning.
Bullmore.
Hi.
Let's start about the connection between inflammation and depression. First, I think you should just give a brief history about what inflammation is and how they're connected.
Okay, so inflammation, a lot of people will be familiar with. It's the body's kind of first line of defense against attack. So if you get an infection in your finger, let's say, it becomes red, swollen, it's obviously inflamed. What people may not understand is that that is just the tip of an iceberg. There's a kind of systemic inflammatory response, inflammatory cells.
Because it spreads.
Throughout the body, circulating throughout the body, and that's how it can get into the brain. It can send a signal to the brain that changes our mood and behavior.
What does the research show about the connection between inflammation and depression?
Okay, so we've known for a long time there's an association. You know, inflammation and depression go together. If you've got arthritis, psoriasis, inflammatory bowel disease, for example, all inflammatory diseases of the body, your risk of depression is going to be much increased. The new understanding is that that association could be causal. It's not just a coincidence. The inflammation could actually be directly causing the depression. And that's a new understanding that we didn't have 20, 30 years ago.
Is inflammation found in all those who suffer from depression?
No. And that's very important because we're not talking about a kind of one-size-fits-all solution to depression. I think that's probably been one of the reasons why we've seen so little therapeutic progress in depression over the last 20, 30 years. It's not just one thing. I think the inflammatory component is probably going to be important for about a third of patients with depression. And then there are a lot of other patients whose primary diagnosis isn't psychiatric. You know, they may have arthritis, as I mentioned already. About a quarter of those will also have depression. So it's not everybody, but it's going to be quite a lot of people.
Can you be having an inflammatory response to something and not know it?
Yes.
And what would that be? What condition would that be?
Well, lots of conditions can cause relatively low-grade inflammation that you might not realize that you have. For example, in the book I talk a lot about dental problems. Those can cause low-grade inflammation. You might not realize it was there. Obesity is another cause of low-grade inflammation. Stress, social stress, can cause inflammation in the body, something that we didn't understand 5, 10 years ago. So there are many factors that wouldn't amount to a disease, wouldn't necessarily have you going to a physician and saying, I've got an inflammatory disorder, but if you do a blood test, there would be some evidence.
We do know about the connection between inflammation and heart disease.
Yes.
We do know about inflammation and dementia, the connections between those things. So the question we have is, and this is something I've recently become very interested in, is anti-inflammatory foods and drugs that we can take, natural drugs. What are they? How can we reduce inflammation?
Yeah, well, it's a critical question. And as you point out, we now understand that inflammation is much more important in many different areas of medicine than we did 20, 30 years ago. So this is another area of change. Now, what can we do about it? Obviously, there are already a lot of anti-inflammatory drugs out there. And we need to do the trials. We need to show that they can directly impact on depression. There's some circumstantial evidence.
But easy ones, like exercising every day.
Exercise, yeah.
Don't smoke.
Yeah.
And you talked about medical apartheid, that really, which I thought was a very strong phrase.
It is a strong phrase.
That we really need to look at this differently.
Well, because
when it comes to treatment.
I think we're a bit split. I think the way that we think about things at the moment, with the mind and the body being quite apart, patients going to see different doctors, different hospitals for treatment of mental and bodily symptoms. I'm not sure that's to the advantage of the patients, and I think we need to break down that barrier between mind and body and thinking about the inflammatory links and the way that the immune system can communicate from the body to the mind is one way that we can break down that apartheid, as I put it.
I say preach, Edward Bullmore.
Thank you very much.
Thank you so much.
I appreciate you coming. The Inflamed Mind is on sale now wherever you like to buy your book.